Good morning, good afternoon, good evening, wherever you may find yourself, and welcome to the You Are a Unique Neurobeing series. Dr. Peggy K. Today is a very important session because we're going to talk about pain, the most motivating symptoms that cause most people to go and see a doctor or a healthcare specialist. Our normal state is actually a calm, peaceful inner state where we can be joyful throughout the day. Pain is a symptom from the body telling the brain that something is not right. To really understand pain, we need to differentiate between what is acute and chronic pain. If I twist an ankle, I fall down, break a bone, that is an acute pain that is due to some type of tissue or bodily harm or damage. And there is a time to heal that tissue. For example, the time to heal a bone will be longer than the time to heal a muscle tear, or maybe a ligament is even longer. So that's usually less than 4 months. And that would be a normal state of the innate inflammatory reaction of our body trying to heal itself. Anything longer than 4 to 6 months becomes chronic pain. And in this concept, I want to talk about what's called microtrauma. Microtrauma is due to repetitive motions, maybe a chronic posture, especially a sedentary lifestyle, where we're actually causing deformation and plastic changes to different soft tissues such as ligaments, joints, and even the way muscles contract and relax in a synchronized form. So chronic pain can be from this micro trauma. When we talk about chronic pain, there's so much more than just a sensory response from the body to the brain. There's also involved components that are emotional, cognitive, and even social components. I want to tell you the story about famous doctor Helena Miranda, who spent many long hours working, taking care of her family, her home, and became very stressed, high stressed lifestyle. I'm sure many women can relate to this. And she started with low back pain, kind of ignored it, took her, analgesics, and eventually that pain went into the leg. She just kept on working, taking care of her family, and over a 10-year period ended up with bilateral hip pain, leg pain, and actually this inner journey of hers encouraged her to write a book called Rethinking Pain. And in this book, a very important quote is, "The best first aid treatment for pain is to activate the brain." Wow, that's where I'm going to take this discussion. Now, there are very specific neural pathways from the brain to the body that are going to help to inhibit, alleviate, or diminish the sensation of pain. And that's what we're going to talk about it. But to do that, we need to understand a little bit the anatomy. So we have our brain, and the brain actually vaginates down into the body, all the way down to the lumbar spine, and it's branching off roots through the whole system to communicate to every cell, organ, muscle, joint, and it facilitates our movement. At the end of these areas are specific receptors that are receiving information to send up to the brain. Pain receptors such as nociceptors, chemoreceptors, and even mechanical receptors. They are sending information up to the brain, and they stop in the spinal cord in an area called the substantia gelatinosa. In this area, there are very important neuropeptides called enkephalins or better known as endorphins. And I like to refer to them as our innate morphine. And what they do when these pain signals come in, they are inhibiting the pain going into the brain. And the interesting thing about this is we can activate this area in our spinal cord, the substantia gelatinosus, with movement. Conscious, slow movement. We are activating these innate morphine endorphins to alleviate our pain. And that's why when you go out to exercise, you feel just a little bit better. So another area we need to talk about that inhibits these pain responses from the body is called the periaqueductal gray area that is along the entire spinal column. It has little interneurons from information coming down from the brain that actually help us to predict danger and helps us to have this defensive behavior. For example, if somebody's going to throw a punch at me and I can just jump back, I can avoid all of this pain, unnecessary pain. So this area is very, very interesting because it's been conditioned from our autonomic nervous system and the limbic system. We're going to talk about these two systems in great detail in later episodes. But basically, the autonomic nervous system is our stress response, and the limbic is the emotional. So if this area, the periaqueductal gray area, is overworked because we're really stressed out, like in the case of Dr. Miranda, she was really stressed with her work, the family, trying to balance out both job, being home, and, being really, really all the time on the go, like many women. This area can be overstressed, and we may be going through some emotional turmoil, some emotional trauma. So that's going to reduce the brain's ability, the brain's capacity to inhibit these pain responses that are coming in from the body. So the last area we're going to talk about is at the very top where the spinal cord and the brain come together. The brainstem is the reticular activating system. It's actually where we have our level of wakefulness. It's where we generate energy and motivation and the level of consciousness that we have. In this area is also integrated postural musculature, breathing, how we breathe, and it also inhibits pain. That's so important. In this area is integrated the intensity of light and sound. So just imagine that I hear boom, and my body jumps. And in that reticular activating system, in that second, I have to differentiate if it was a life-threatening sound like a gun, or maybe just somebody dropped a book. And I can say, okay. And it'll change my body tone just because of my awareness of what happened with that intense light or that intense sound. It's also really important because when we wake up in the morning and if we feel motivated and that energy getting out of bed, when we start moving our body, a lot of times it's inhibiting our pain response. Have you ever noticed, like in the evening when you're more tired, you spent all your energy, the pain becomes more intense because our reticular activating system is shifting gears. So that's a very interesting concept because we can actually shift gears with our consciousness and ask ourselves, what is the message that these incoming pain receptors want to give me? Do I need to change a behavior in my daily life? Maybe the way I eat? Do I need to maybe change the way I'm relating to other people? My suffering mindset? These are concepts we're going to be talking about further on. There's a lot of things we can do to change our actual consciousness about pain and the message that this pain wants to give to us. And I'm going to give you a little hint for the next episode. It's just a breath away.